Hello, everybody, and welcome to this special RPTH Research Recap, where we dive a little deeper into the science being published at RPTH. Today's recap is focused on pediatric thrombosis in honor of Blood Clot Awareness Month. My name is Marisol Betensky, and I'm an assistant professor of pediatrics in the Division of Hematology at the Johns Hopkins University School of Medicine, and a pediatric hematologist in the Johns Hopkins All Children's Hospital. My clinical expertise is specializing in providing care for patients with complex thrombotic disorders, and I am also a co-author of the recent ISTH Pediatric VTE Treatment Guidelines, which should be coming out any day now, so keep an eye for them. Today, I am pleased to introduce Dr. Laura Avila and Jennifer Vincelli. Dr. Avila is a clinician scientist at the Child Health Evaluative Science Program in the Research Institute at the Hospital for Sick Children in Toronto, Canada. In there, she leads a research program in long-term complications of thrombotic events in pediatrics. And her research interests are focused on the assessment of outcomes of thrombotic events in children. Jennifer Vincelli is a nurse practitioner in the thrombosis program at the Hospital for Sick Children, also in Toronto, Canada. Her primary focus is the clinical care of children with thrombosis and anticoagulation management of these patients in the outpatient setting. Her current research interests are focused on the assessment and management of post-thrombotic syndrome in children and adolescents. Finally, we're also joined by Dr. Mara Nuñez Toscano. She's an attending physician in the hematology department at the Instituto Nacional de Pediatría in Mexico City, and a member of the World Thrombosis Day Steering Committee. Today, we look forward to hearing everyone's insights after this presentation. Dr. Avila and Jennifer Vincelli recently published a paper in RPTH titled Health Literacy in Pediatric Thrombosis, a Landscape Analysis. As you may know, and as I mentioned, March is recognized as Blood Clot Awareness Month, a time dedicated to increase public understanding of blood clots and their potentially life-threatening complications. In alignment with this awareness effort, this study emphasizes the critical role of health literacy in the management of venous thrombotic events, or VTEs, among pediatric patients. Enhanced health literacy can empower young patients and their families to better comprehend their condition, adhere to treatment plans, and ultimately improve health outcomes. For those joining us live, please leave your comments in the chat, and we will be answering them during the discussion. Laura and Jennifer, we look forward to hearing your presentation.
Great. Thank you so much, everyone, and thank you for tuning in to our presentation on our recent publication, Health Literacy in Pediatric Thrombosis, a Landscape Analysis. Health literacy is the ability to obtain, read, understand, and use healthcare information in order to make appropriate healthcare decisions. It requires a vast range of skills, including oral and written communication, numeracy, navigation, information seeking, and the ability to perform tasks based on the information obtained to promote and maintain health. Therefore, health literacy is a set of cognitive and social skills that can influence self-efficacy and self-management, thereby improving overall health outcomes and health-related decisions. Health or reduced health literacy is actually a global issue. Greater than 50% of adults have reduced health literacy across many countries and continents, including Japan, Australia, Canada, Spain, and many other countries. However, there is very little research on health literacy in children and their caregivers. We often ask our healthcare or our parents and children, to manage disease or thrombosis with disease-specific strategies, including anticoagulation and the use of compression garments, for example, in post-thrombotic syndrome, and to promote healthy general lifestyle strategies for prevention and management of poor outcomes. But we often have to ask the question, do they actually have the health literacy to implement these asks effectively?
Thank you, Jen. So now moving to the objectives of the study with that background, the main objectives were one, to assess the general health literacy levels of our population and their thrombosis-related knowledge, and we'll go into details of what that exactly means. And the secondary objective was to explore thrombosis-related content knowledge in a subset of these patients. To do that, we conducted a cross-sectional study in our thrombosis clinic at SickKids, and we enrolled patients aged 10 to 18 years with a history of venothrombotic events and parents or caregivers of children aged 0 to 18 years with also a history of a venothrombotic event. In that population, we administered a series of surveys and questions, and the first set of instruments were intended to address or measure general health literacy levels, which is part of the main objective, and that included the REALM tools. Those are word recognition tests that can determine reading skill levels, and depend on having the participant read a series of words and seeing whether they have difficulty pronouncing those terms. And if there is some difficulty there, then you can infer that there will be difficulty comprehending information. That's one of the tests. And the score that you get is transformed in grade range equivalents. And the implication of those grade range equivalents is that if an adolescent has a grade range equivalent below 7th grade, or an adult has a grade range equivalent below 8th grade, they will have trouble reading educational material. HASA is a more comprehensive health literacy tool that assesses 3 different levels or different domains in health literacy, namely the communication domain, confusion domain, and functional domain, which is writing and numeracy, and provides a score for each one of them. And lastly, we also administer the eHeals, which is the electronic health literacy tool that determines knowledge, comfort, skills using the internet to find, evaluate, and use health resources. So that was for just the general health literacy levels. And we also assess thrombosis-related knowledge, also part of the main objective, through self-reported questions or statements to which participants will agree or disagree. And the statements were we divided them into 4 categories. One related to perception of knowledge. The statements were, I know the treatment for blood clots, I know the symptoms for blood clots, I know the long-term complications of blood clots. Another area of the thrombosis, or perceived thrombosis knowledge, was satisfaction. I am satisfied with what I know about blood clots. The next area was belief. I believe that learning about blood clots is important. And the other part, because we have many patients that have other underlying conditions, is whether they knew as much as they knew about other conditions as they knew about blood clots. So the statement was, I know about thrombosis as much as I know about other health problems. The exploratory analysis or the exploratory objective was to determine actual thrombosis knowledge through multiple questions, and those were addressed to a subset of adolescent participants only. 6 multiple choice questions for them to determine the proportion of, and then we determined the proportion of answers that were correct. For the analysis, we compare, for the main objective, the health literacy levels, general health literacy, and thrombosis knowledge. We compare them between patients, so the adolescents, and parents and caregivers. And the content knowledge, so the exploratory analysis that only enroll adolescents, we compare the proportion of answers that were correct between those satisfied and those dissatisfied with their thrombosis knowledge in general. So this is kind of comparing what they think and they know with what they actually know. Moving to the results, we recruited 50 adolescent patients that were aged, the median age at the time of participation was 60 years. 60% of them were females, most of them had DVTs, so 68% had DVTs. And the important feature here is that most of them had at least a median of 2 visits to the thrombosis clinic and over 2 years of exposure to their own diagnosis of VTE at the time of study participation. We also enrolled 51 patients or caregivers of patients of all ages. Most of them were in their 30s and 40s. Most of them had their child having a DVT as well. You see the thrombosis location at the bottom of the table. And again, most of them had at least 2 visits to the clinic before being enrolled in the study. These are the results of REALM instrument, those word recognition tools. And on the left-hand side, we had the results for the teenagers, and the right-hand side, the results for the parents and caregivers. At the bottom on the x-axis, you can see the grade range equivalent. And 30% of the adolescents scored in a grade range equivalent of 7th grade or below, meaning that they will struggle with medical educational material. And similarly, 24% of the parents and caregivers score in a low and grade range equivalent that will imply that they will be struggling with educational material. And there was no significant difference between the two groups in terms of scoring low or high with these instruments. In terms of the HACCP, that's the more comprehensive health literacy assessment tool. You can see the results here in red are so we have a bar for each one of these domains that the two measures, and in red, the percentage of patients or participants that score low in that domain. And so the level of low health literacy in different domains range between 14%, as you can see in the functional health literacy for parents and caregivers, and the highest low health literacy was in the communication domain for patients. And across the two groups, most of the struggle was in the communication with healthcare providers in that domain specifically. In terms of the electronic health literacy here, the score for the tool ranges between 8 to 40 points, 40 points being the maximum and higher electronic health literacy. And you can see that the scores are pretty high. The median score 30 and 29 for parents and for adolescents, without significant difference in terms of the self-perceived electronic health literacy, so accessing health information through the internet. Overall, 74% of adolescents and 59% of the parents and caregivers had one or more measures that indicated low general health literacy in this population. In terms of the self-perceived knowledge, answering these statements about agreement and disagreement with the statements about knowledge about thrombosis, we can see the results here. On the top, we have the results for the adolescents, and the bottom, the responses for the parents and caregivers. In red and orange color, the disagreement side, in the green color, the agreement side, and in yellow, the neutral. And we can see that despite being or having exposure to their being diagnosed with thrombotic event about 2 years prior to study participation, we have about 30% to a half disagree with statements disagree over neutral to statements about knowing the symptoms of blood clot, treatment options for a blood clot, and long-term complications of a blood clot, without significant difference between parents and caregivers. In terms of knowledge satisfaction comparisons, comparative knowledge and beliefs, we can see that most of the participants thought it was important to learn about blood clots, but in terms of satisfaction, and again, going back to the idea that they had exposure to education through clinic, they still were not satisfied with, or were neutral to a statement, I am satisfied with how much I know about blood clots, with parents being a bit more or less satisfied than adolescents. And that was the only question that was significantly different between the groups. And only half were satisfied with what they knew about blood clots as compared to other conditions. So they thought they knew about the knowledge about blood clots as compared to other underlying conditions, which we were expecting, because in general, then the patients tend to learn more about their underlying condition, and they learn about the complication of the underlying condition being blood clots. In terms of the exploratory analysis, we enrolled 31 adolescents for that one, for that part of the analysis, and we asked about these multiple choice questions about thrombosis. And in the y-axis, we can see the proportion of correct responses, and in the x-axis, that we had the two groups: the adolescents that were satisfied with their knowledge, and the ones that were not satisfied with their knowledge. So the scores for the ones that were satisfied were a little bit better, but there was no significant difference between the two groups. And this is expected because it is known that adolescents tend to overestimate how much they know. And interestingly, there was a significant correlation between the content knowledge, so how much they knew, and the reading ability using the REALM score. So the higher the reading ability, the more likely that they provided correct responses to the knowledge questions. So there was an agreement there. So in conclusion from the study, we found that 74% of adolescents and 59% of parents or caregivers with a venous thrombotic event or exposed to the venous thrombotic events or the diagnosis and having coming to visits in the thrombosis clinic had one or more measures indicating low health literacy. Participants struggle most with the communication domain, and in the communication domain, communicating with healthcare providers. we found that 30 to 45% of participants in both groups did not know the symptoms, treatment, or long-term complications of blood clots despite their diagnosis. And about half of them to 2/3 of them were not satisfied with how much they knew about thrombosis. That brings us to the end of the presentation. Thank you so much for your attention, and happy to take any questions.
Thank you, Laura and Jennifer, for that great presentation highlighting the disseminating research during Blood Clot Awareness Month is essential to educate healthcare providers, patients, and the public about the importance of health literacy in preventing and managing pediatric thrombosis. This is why the World Thrombosis Day campaign focuses on spreading awareness about the thrombosis and providing resources all year long. We know that the overall impact of the World Thrombosis Day 2024 campaign reached exchanging 4.4 billion of people worldwide. This is a significant increase. Achievement, and the World Thrombosis Day campaign was featured on the homepage of the World Health Organization Knowledge Action Portal. This recognition reflects the increasing importance of thrombosis awareness in global health efforts and highlights the campaign's growing influence on the worldwide stage. The World Thrombosis Day campaign saw in 717 increase in website traffic in 14 languages. That's why we can go to the page and look forward to the information that we have in the website. Now, this is the first time also that the World Thrombosis Day campaign add pediatric content, recognizing that we have to work hard in this field. Now, this is the time for the Q&A session. So my first question to Laura and Jennifer is why do you believe that the application of prevention strategies in thrombosis, in pediatric thrombosis in the world has lagged behind?
Thank you, Mara, for the question, and again, thank you for inviting us to this presentation. There is, in the literature, they have described the investigation or research in health literacy in adolescents as very stagnant, and there's a lack of research in this area, so it's kind of widespread. There is there are more studies about adult health literacy than pediatric health literacy in general, so it's not surprising that thrombosis is also lagging behind. Thrombosis is also kind of newer in a newer subspecialty, so it's not surprising also that we are in that area, and happy to get the conversation started and developing strategies to overcome this problem. But I think it's part of a general problem in investigating health literacy in adolescents in general.
Thank you, Laura. And do you have, or Jennifer and Laura, even Marisol, do you have any suggestions for all the professional that is involved in the pediatric care to think about thrombosis, to diagnose better and create some strategies to think about thrombosis?
Yeah, thank you for that question. I think, the analysis very clearly identified that participants struggled the most with communication in terms of the health literacy, that component of health literacy. So we kind of compiled some strategies that might be helpful during a clinic visit or bedside visit that may help improve health literacy for both patients and their caregivers. Certainly, we can be more mindful of slowing down our conversation. I think we're all very guilty of, having lots of patients to see in a busy clinic day, and sometimes maybe rushing through the content or assuming that they are actually hearing what we are delivering in terms of our messaging. It's also obviously helpful to use plain non-medical language. Sometimes in certain patient groups, depending on the content that you're teaching or talking about, it might be relevant to sort of relate it to everyday examples that they can better understand. Limiting the content of the teaching component to 2 or 3 key points per session. So maybe we don't want to go through the entire gamut of, risk factors for blood clots and what the potential outcomes are and how we treat, post-thrombotic syndrome, for example, all in one sitting, because it might just be too much for patients and their families to absorb. Sometimes it's also helpful to repeat key points, making sure that you hit those key points several times during the visit. Using the teach back technique is also helpful. So, providing some information about a particular topic and then asking the patient or family member to repeat back to you in words that they understand. And lastly, instead of just asking at the end of the visit, do you have any questions? Ask them to provide you with questions that they might have during several time points throughout the visit. Might be beneficial.
Thank you. Marisol, can you add something, or can you ask a question?
Yes, of course. Laura, Jennifer, excellent presentation and really important topic. I do have a question. So in your study, you used 3 different tools to measure health literacy in your patients. As a clinician, how can we do this in the office? Do we necessarily have to use these tools? Are there other ways in which we can measure health literacy in our patients and their caregivers?
Thank you, Marisol. If you need to know, I will say that the REALM tools is as a screening tool work at least in our study very well. It's very quick to apply. It's just reading a series of questions and of words and seeing how kids pronounce. There is an adolescent version, so you can use that if you wanted to. It takes a minute to apply, okay. But otherwise the general recommendation is to use universal precautions. So just address the patient as if they have low health literacy, and that should be more than enough. Just start your visit thinking that and going over all the tips that Jen described. Just use universal precautions for everyone, and make sure that you prepare your educational material with the same level of attention to the detail of the possibility that your patients may have low and general health literacy.
Excellent. Now there's a question in the chat. Any link regarding health literacy with social status, income, revenue of parents? And I may piggyback on this one also with culture and general cultural beliefs, language, and how your culture influence how you perceive well-being and health.
Yes, there are so many questions that come after that. We didn't measure any of these things. We weren't trying to explain low health literacy to begin with. We're just trying to map. It was kind of a discovery journey for us to understand the level of our population. And it was, an important discovery for me in terms of understanding the needs of our population and the communication area. Sometimes we try to convey too much and show patients that they're taken care of, and I know these things. So I'm just trying to give so much information that is absolutely detrimental to the communication and establishing the link and making sure that they understand. It just completely backfires, goes in the opposite way. So just slowing down and following all these tips will be relevant. So yes, there's so many things that can be done after investigating so many links and explanations for this and finding potentially high-risk patients, but universal precautions will always be there to help you troubleshoot that and just make sure that you address all the patients as if they have low health literacy to begin with.
Yeah, and it probably becomes really complex as you start. I noticed, for example, in your study, over 90% of patients use English or prefer English as their first language. And, this probably becomes a little bit more complex when you're dealing or practicing in settings where people prefer other language than English. And then you have to involve interpreters in your conversations. And then you have to develop materials in different languages, etc.
Yes, I know Jen has a ton of experience around that, dealing with translator. We have a large population of immigrants and newcomers to Canada, so it's very common to see that problem. Teenagers, their kids, they pick up on language quickly, but parents may struggle, and they're the care providers. So it's and they have a different level of communication, which makes it even more complex. Is they're coming from different sides, and the needs of one won't cover the needs of the other group. So it becomes difficult for us also to strategize and make sure that whatever the instruments that we have, the education material can target both groups. They have different needs, and that makes it complicated.
And I'm wondering too, if when we were recruiting patients, did we get a sense that those who were did not have English as their first language, were they less inclined to participate in these questionnaires than patients who were fluent in English? Do you know, thinking back?
I think no, I think we didn't struggle with refusal. I think we had more than nearly 80% recruitment rate, and people who didn't enroll were usually busy. They want to go home. Yeah, that was the limitation. But we always try to get everyone involved, and try to avoid that kind of bias in the sampling.
But I do think it will be interesting.
I think
how language and culture influence your health literacy, especially when you're on a foreign country, or and also the complexity of the health system.
Yeah, and we have lots of beautiful educational materials and a whole learning hub that we direct our patients and families to, but we are limited with the languages that we offer those resources in as well. So that might be something to consider as well.
Yeah, and the material may work well for parents, but it's not exactly what kids want to consume. So that's the other part of the challenge that I was referring to before. Just the interventions that may work for some may not work for both groups equally. It's a different generation, right?
Yeah, in that sense, you can use some material that World Thrombosis they create. It's not special for kids, but we are thinking about creating some material for kids. But we had nowadays material for some specific resources like cardiovascular or inpatients, or even we have in different languages. So you can use this material to share with the patient or with the families to know more about the thrombosis in different. Nowadays we have in 14 different languages, so you can use you feel free to use that. Yeah,
that is fantastic and great to know that those resources are available.
Yes. And I don't know if you can give us some strategies to for other countries, maybe reach the world countries to create these networks with the patients in order to have better communication, to give some advices to the families to create this consciousness about the thrombosis.
In terms of educational material, or in terms of community building?
In terms of community, or both, yeah, if you want. But in terms of create this conscious or this knowledge about the thrombosis in the population.
Yes, I think now societies are integrating more and more patient partners in their groups. So that might be one way to get this started. Thrombosis Canada recently launched a material developed by patients. That's another thing to look at. It's a different population, different language for adult patients, but still is a step forward getting patients involved in creating this material. So that's another way through societies and through different organizations to work together to get patients and researchers and clinicians together to work toward getting this, the resources necessary.
And I think using possibly ways that adolescents especially like to communicate. So taking advantage of technology, like the development of apps and communication via email and TikTok and all that stuff is probably important and really needed to be integrated in these communication strategies and these educational strategies, particularly for the young population.
And like Jen mentioned in our About Kids Health Thrombosis Hub, and we have some videos developed by patients relating their story, and so they are divided into diagnosis, and there is patients relating their story, and then the clinician talking about, and Jen is also in those videos talking about giving a bit of educational information, but with the patient involved already there to share their journeys in thrombosis. So that may be something that adolescents can gravitate towards. So when we have a new patient, we just offer that resource for them, trying to step up the game here.
And I think making a concerted effort to involve adolescents in the clinic visits and sort of taking management of their follow-up care. I think sometimes parents want to hijack the conversation or the questions. But I do think kids have some pretty great questions and curiosities that we can help with, and so just encouraging that from them directly would be helpful.
Excellent. Thank you so much, guys. Mara?
Thank you. I don't know if we have another question, but or if you want to add something to this important topic and awareness, Laura and Jenny and Marisol, you can add something?
Just maybe reiterate the fact that we should use universal precautions, just treat everyone as if they have low health literacy. That would be a great strategy, even if you don't have the real tools or anything to screen for or to use for screening. Just start that way. Speak slowly. We can do a lot, and just training clinicians to communicate with patients and families, and direct them to the resources that we have. I think that's another small step that we can, start developing building our practices.
And I think highlighting probably the future research needs in this area, right? Like understanding better how social, economic status, level of education, culture, language may influence your health literacy, and maybe the need for more tailored or targeted strategies for those patients that may be at highest risk of, falling through the cracks when it comes to health literacy.
Yeah, and we have to think. Sorry. Go ahead.
No. I was going to add that in terms of predictors of health literacy in adolescents, one of the main predictors has been in several studies the health literacy of parents and their caregivers. So when you're talking to the family, you're building a champion in there. Someone is going to start teaching each other, and maybe it will be the child teaching to parents, maybe it will be the parents teaching to the child. So it's just you have to work with everyone, and someone is going to take over and will increase the health literacy, not only in their families, it also goes to society. So the time that you take to build that is well spent.
Yeah, and I think this is the time to create these networks and work. And I think that the kids this is a health problem, that the thrombosis exists. No, thank you so much, Laura, Jennifer, for this presentation, for your work, and give us more insight into this vital importance of health literacy and managing of the venous thrombotic events in pediatric patients. By improving health literacy, young patients and their families can gain a clear understanding of the condition, follow treatment plans more effectively, and achieve better health outcomes. We hope viewers will read the full detail on your paper on our site, rpthjournal.org. And if you are interested in joining to the World Thrombosis Day campaign that I mentioned before, you can visit our website at worldthrombosisday.org. That this is the first time that we have pediatric content, and you can review some material there. And thank you for those that can join us live. And don't forget to follow on Facebook, LinkedIn, Twitter, X, and YouTube. Thank you for watching, and keep an eye on this next RPTH recap on World Hemophilia Day. Thank you so much.
Thank you.
Thank you.
Bye-bye.